Now, with the right tools, cervical cancer can almost always be prevented. Here to tell us about these tools is Dr. Bradley Monk, who is a gynecological oncologist at St. Joseph's Hospital, along with his patient, Kelly Meservy. It's good to see you both. Thank you for joining us. First, I have to ask you, Dr. Monk, what is a gynecological oncologist? Am I even saying that correctly?
That's right, gynecologic oncologist, and thank you, Lisa, for having me today.
Absolutely.
So gynecologic oncologists specialize in cancer. You're like, well, every cancer doctor specializes in a cancer. No.
Right.
Cancer specialists generally specialize in a treatment, surgery, radiation, or chemotherapy. My specialty was created out of OBGYN to treat women with vulva, vaginal, cervical, uterine, fallopian tube, and ovarian cancer. So we do surgery, chemotherapy, radiation, whatever it takes to help women with those cancers.
Okay, that makes sense, and I understand it. Now, what causes cervical cancer? I know we're focusing on cervical cancer today.
So cervical cancer is highly preventable. That's why we're here. Cervical cancer is caused by a virus. Many of the listeners may not know. And this is an extremely common virus, a virus that happens when we touch each other, generally through intimate sexual contact. But to be clear, it doesn't require promiscuity, sexual deviance. This is maybe 80% of the public has or gets this virus. Most women never know they have it. Most women get over it. And this virus is called the human papillomavirus, or HPV.
Sure. Now, we have heard of that. Kelly, would you mind kind of telling us your story?
Sure.
Briefly? Yeah.
I was diagnosed in 2007. I was very, very, very faithful of getting my pap tests every year. I don't do a lot of things faithfully, but I did do that. And so I thought the pap test was everything, was going to catch everything. I didn't know that I was supposed to ask my doctor for anything else. I was doing my thing every year, and it wasn't until '07 that my doctor saw with sight that my cervix was diseased. So by then it was cancer. There was no finding it early. It was already too big to have surgery. So I went through chemo and radiation, internal radiation, and I was cancer-free. And then in '09 I developed a chronic cough. And it took about 4 or 5 months for every specialist, pulmonary specialist, everyone, to find out after the second lung biopsy that those same cells now are in my lungs. So I just finished my 54th chemo treatment. For the last 1 year, since 2010, I've been under Dr. Monk's care. And we're just fighting it and believing it. And it's completely preventable. Had I told my doctor that I wanted the HPV test, it doesn't require anything more out of me. I'm already there. I'm already uncomfortable. It's just him doing that extra test.
Why don't we know about this? I mean, I'm sure a lot of women don't think to ask. So we should be asking for the PAP and the HPV test?
That's exactly right. So cervical cancer prevention is really 3 things. When you're young, 12 years old, get vaccinated. We can prevent this virus with a simple, safe vaccination. Completely safe, despite all the misnomers. And then when you're in your 20s, get your pap test. And then when you're in your 30s, maybe you have this virus. You probably got it when you were younger, and you're a chronic carrier. So we can test for the virus right on the cervix. It's just like a pap test. So over the age of 30, every one of your listeners, I would hope, would know what their pap test shows and know whether or not they have HPV on their cervix. And if it's negative, you're good. But if you have HPV on your cervix, it's not your fault, but you're at increased risk for cervical cancer, and we can find early cancers that can be cured.
Are there other risks associated with getting cervical cancer?
Smoking, but that really means that smoking helps the virus grow better. So it's all about the virus. So this cancer, this prevention, it's about execution. We know how to do it. Every cervical cancer can and should and will be prevented with vaccination and screening, which includes pap testing and checking for the virus on the cervix.
And it's interesting, too, because we talked about the vaccine, and you were saying it's not just for girls, young girls, it's for boys as well.
It's now FDA approved for boys as well, because boys can get anal cancer that's related to the virus, head and neck cancer that's related to the virus, penile cancer that's related to the virus. This is a virus that you don't want. You can prevent it, but we can also test you for it on your cervix.
And it must have been surprising for you, Kelly, to know that, boy, I could have asked for this test and things could have been different.
It's completely preventable. It's real. It's cancer. I have it, but it's totally preventable. So no one else should have to go through it.
Wow, so very important. And I want to ask you that, why don't our doctors just automatically do it?
So
the HPV test.
Many doctors do, okay, to be clear. And there's concerns about reimbursement, which now has been solved. There's an educational component. If you're HPV negative, then you don't need cervical cancer screening for 3 years. I think doctors at some level are concerned that women only go to their doctor for cervical cancer screening, that they're not going to come back for 3 years. That's not the message.
Okay.
The message is this is a better test. Still see your doctor every year because you need your cholesterol checked, your blood pressure checked, all these other issues. But if you're HPV negative, it's such a sensitive test that you don't need retesting for 3 years.
Gotcha. Very good. Thank you both for, Kelly especially, thank you for coming in and telling your story, and we're glad to see you're doing well. But
Thank you.
It's an important thing to know, and thank you for your advice there too, and telling us what we need to do. So you saw the numbers, you saw the graphic about the vaccine, getting your Pap test, and asking for that HPV test over the age of 30. So if you want more information, all of this, of course, is brought to you by QIAGEN and the DIGEN HPV test. And if you want more information about all this, please go to thehpvtest.com, do your research, and know what to ask for the next time you go see your doctor.